Hi everyone, I'll just share my screen. So I just want to introduce myself, and I'm looking forward to it's nice that it looks like this is a small group because then I think we could probably have a nice discussion after this presentation. But my name is David Scales. I'm a physician and sociologist at Weill Cornell Medical School. I work at New York Presbyterian Hospital. I'm a hospitalist, which is the type of doctor that you would see if you came to the hospital and were admitted into the hospital and you weren't having surgery, you would very likely be on a hospitalist team. I do general internal medicine, and I'm here to talk to you about the COVID-19 vaccine, in part because a lot of the research that I do is working with various different communities, particularly Black and Latinx communities, a lot of Arab communities in the Middle East, on building vaccine confidence about the COVID-19 vaccine. So a lot of what I'm doing on a day-to-day basis is understanding kind of what questions are out there about the vaccines, and trying to help orient people to trustworthy sources. So I don't want to imply that I have all of the answers. I'm here to answer as many questions as I can. But what I can do is very much point you in the right direction for any questions that you do have that I can't answer, so that we can all learn from them. So with that, I'll get started. And again, I'm going to try to keep this presentation a little bit on the brief side, just so we can have time for discussion and questions and answers. With that, so let's get started. I think, the main question that I'm hoping a lot of you are asking is why should I get vaccinated? Or potentially you might be talking to people in your family about, and they might be asking you this question. So there's a couple of different reasons. One is to protect yourself. Another is to protect your family and your community. And then lastly, as more and more people get vaccinated, that will help us end the pandemic and we can start to get back to increasingly more normal life. Now, it helps protect yourself, obviously, because the vaccine that you get protects yourself, but it also helps protect your family because and your community, because people who are vaccinated transmit the virus less than people who are not vaccinated. So by getting vaccinated, you're helping not just yourself, but you're helping protect other people around you who might not be able to get vaccinated. Now, to protect yourself, this is, extremely important because patients that get COVID-19 can have a lot of really bad symptoms. Some of the symptoms are, things that sound like a common cold, like congestion or runny nose, fevers, chills, coughing, some shortness of breath or wheezing, fatigue. Sometimes people get diarrhea, a lot of aches and pains, headaches, new loss of taste or smell, or a sore throat. In this presentation, it was last updated in July. This is an official New York Presbyterian presentation. So just giving you a little bit of an update, it's like we have now reached over 700,000 deaths nationwide from this pandemic. So, it's obviously important to protect yourself, not just to prevent these symptoms, but there's a significant proportion of people who, even after they've had COVID-19, can have long-term health problems. Some of the biggest long-term health problems that I've seen have been kidney problems, strokes, so a number of different things that can come from getting COVID-19. And the vaccine helps reduce your chances of all of these things. So the vaccine is very much a clear winner. A lot of the data is in favor of just how powerful the vaccines are as a tool to help prevent COVID-19, symptoms from COVID-19, and the long-term health problems that could come from COVID-19. So some people ask the question and kind of suggest that natural immunity quote unquote natural immunity is better. And I call it quote unquote natural immunity because there's no such thing as natural or unnatural immunity. From our body's perspective, there's only immunity. Our body doesn't really care how it got there. Our body kind of has a number of different mechanisms to fight diseases. And it's not, it's not asking for people's driver's license to find out whether or not they're natural or not as the body gets exposed. One of the things that we do know is, yes, if you happened to get infected with COVID-19, it does provide some protection because your body fights it off, and then you are at lower risk of getting infected later. But that protection seems to decline over time. And so your chances of getting COVID again increase over time. And one of the things that we know is if you have gotten COVID infection and then you get a vaccine, then your levels of immunity, your ability to fight off the virus is off the charts. And so, while I very much do not recommend, just getting infected with COVID-19 as a way to become protected, if you did happen to get the infection, it's a good idea to get vaccinated because that should protect you even longer after recovering from the virus. A couple key facts about the COVID-19 vaccines. Getting vaccinated can help prevent you getting sick with COVID-19. All the studies showed decreases in hospitalizations, decreases in deaths for those people who've been vaccinated compared to those who were not. People who've already gotten sick with COVID still benefit from getting vaccinated. There's more and more evidence coming out to show that this is true. COVID-19 vaccines cannot give you COVID-19. That is absolutely impossible. Now, just to be clear, there are some side effects from the vaccines that sometimes people experience, but these side effects are, compared to the virus itself, relatively minor. And COVID-19 vaccines will not cause you to test positive on COVID-19 viral tests. And this is a key important point, is the viral tests detect the virus itself. And so, it can't, the vaccine cannot, there's no way that the vaccines themselves can cause you to be positive on a viral test. Now, of course, there are some tests that are looking to see if you've had an immune response against COVID-19. And in a lot of cases, those tests will be positive after a vaccine, and we want them to be, because those tests show that you have some immunity against COVID-19. Now, people often ask me if the vaccines work. Short answer is yes. I can't say that emphatically enough. Now, all COVID-19 vaccines currently available in the United States, that's Pfizer, Moderna, and Johnson & Johnson, have been shown to be highly effective at preventing COVID-19 disease. So if there's one take-home message that you take from this presentation, it's that the COVID-19 vaccines work. Please remember that. I'm happy to go into the data, for those of you who follow the medical field or read the New England Journal of Medicine, this is where we get our information. And these were very high quality studies done, randomized, placebo-controlled, blinded, all of the important kind of quality metrics in our studies that have shown very robust immunity against the virus. Now, a lot of people have been concerned because the vaccine was made quickly, but I just want to be clear. So this COVID-19 vaccine is based on decades of research for similar vaccines. To give an example, I actually happened to work in the laboratory with Drew Weissman and Caitlin Carrico, who developed some of the foundational technology for this vaccine. I started working in Drew Weissman's lab in 1999. So this technology has been under development for a long time. So when it came to actually getting these vaccines through the FDA, one of the ways that it was able to happen a lot more quickly is the timelines for all the different studies that pharmaceutical companies have to do to get through the FDA they were overlapped. I mean, as you know, the vaccine was a high priority. The pandemic came and people kind of dropped everything that they were doing. And so all of the things related to the vaccine kind of went to the top of the line, became the highest priority, and sped up the process. All of those different stages of clinical trials were done all at the same time so that all of the data could come out as quickly as possible. So this is important to know because by overlapping the timelines, there were no shortcuts taken. All of the same safety standards that are usually applied to all pharmaceuticals, all the expert reviews that take place, all of those took place with the COVID-19 vaccines, but they were accelerated because the COVID-19 vaccines went to the top of the line, became everyone's top priority, and very much, all of the expert reviewers and people at the FDA cleared their schedules to make sure that these things could get through as quickly as possible. It's very unusual, and it takes something like a global pandemic for something like that to happen. So you might have been hearing in the news about the new Delta variant. Viruses, as you know, they are passed from person to person. And as viruses spread, they change. And so as they change, they start to adapt to their environment and sometimes form new variants that can be more infectious than other variants. So, this is the case with the Delta variant. We're finding that it's more transmissible than previous versions of COVID. But what's important to know is that the vaccinations that we already have are actually very efficacious at stopping infection, even with the new variants. Every variant that has come out so far, there's still robust protection that we've found with the existing vaccines. So, when we ask, do the vaccines work? The answer is yes. And then if we ask, do the vaccines still work even as new variants are coming out? The answer is yes. So this is really still the most important measure that we can take, both individually and as a society, to protect ourselves and our community against even the new variants of COVID-19. So is the vaccine safe? Now, I alluded to the fact that there are some side effects, so let's talk about that. The vaccines are overall very safe. Vaccines were studied in tens of thousands of people. By my count, the clinical trials had over 50,000 people for all of the different vaccines. So that's a lot of people to check to see if they're safe. And now well over 200 million people have had at least one dose in the United States and over 1 billion worldwide. So, you might hear things in the news about different side effects or different kind of concerning things that come up. But the nice thing to know is every side effect that I've been hearing about, some people talk about clots, some people talk about inflammation of the heart. All of these are extremely rare, like one case in tens of thousands of people or one case in hundreds of thousands of people. So thankfully, that tells us that these vaccines are extremely safe. Now, the vaccines, it is important that they're not foolproof. When we talk about, you might have heard numbers floating around like 95% efficacy. We have now learned that, 95% efficacy still means that 1 out of every 20 people who've been vaccinated might actually still get infected. We know that people are getting what are called breakthrough infections, and a very, very small percentage of people who've been vaccinated can get a breakthrough infection, and small fractions of them can end up in the hospital, and in extremely rare circumstances can end up passing away. But it's important to put that in perspective. So let's just look at New York City from, essentially from the winter, spring, and summer. So 96.1% of the cases in New York City were unvaccinated people. So the blue in these circles represents the unvaccinated, while the yellow orangey color represents the vaccinated people. So the vast, vast majority of people who got infected with COVID-19 were not vaccinated during this time period, this 8 months from January to August. So this actually matches very well with the clinical trials that we've seen. So we should not be surprised by that 96.1 number. It's actually a little bit better than the reported clinical trials. Now, if we only look at people who got hospitalized with COVID-19, 96.9, so almost 97% of the people who were hospitalized with COVID-19 during this time period were not vaccinated, and 97.3% of the people who died were not vaccinated. So you can see if you are vaccinated, you have very little chance of getting COVID, very little chance of getting hospitalized with COVID, and then even less of a chance dying from COVID. So this is why the vaccines are really your best protection against all of these potential outcomes with COVID. So to put this in other numbers, so unvaccinated people have 5 times more COVID-19 infections than the fully vaccinated, and 29 times more hospitalizations than those that are fully vaccinated. My experience in the hospital is I have only seen one patient who was hospitalized with COVID who was fully vaccinated. I had unfortunately seen a couple people who got hospitalized within a couple of days of their first dose. And so they had COVID, but it hadn't had time to kick in yet. The vaccine hadn't had time to kick in to protect them from COVID. And so it's very unfortunate, but some of them did end up hospitalized. Now, who can get the vaccine? So right now, all New Yorkers aged 12 and above are eligible for the COVID-19 vaccine, regardless of your immigration or your insurance status. Because the COVID-19 vaccines are free, you do not need a social security number, you do not need a government ID to get the vaccine. So that's very important. Anyone that you're talking to that kind of is expressing concerns about the vaccine, I think this is very important information to share with them. Now, if you do want to make a vaccine appointment, these are the places that you can go. So 833 NYS for Vax. There's also kind of the ability to do this in Spanish, 833 Somos New York, Somos NY. And there's COVID-19 vaccine hotlines at that 877 VAX for NYC. And of course, you are more than welcome to come to New York Presbyterian. We have the ability to vaccinate you as well at 646-697-VACC. So after vaccination, so this is really important because we are dealing with the COVID Delta variant, which is more infectious. It's still important to cover your nose and mouth with a mask, especially in public places. Like when I go grocery shopping, or if I'm in any place where there's lots of people indoors, I'm still wearing a mask. I'm wearing a good mask. I'm usually wearing kind of one of those hospital masks that do show higher efficacy than some of the looser fitting cotton masks that might have been made at home. It's important to still kind of maintain some distance, stay about 6 feet away from people at least. I try to avoid crowds and poorly ventilated spaces. So especially if I'm in a place like an elevator or something like that, I am wearing my mask. And of course, do the things that you've been doing since the start of the pandemic, washing your hands, cleaning and disinfecting kind of frequently touched surfaces. After you get vaccinated, you can enroll in VSafe, which will ask you some questions about your vaccination and how things are going and any side effects. And if any questions come up about health or vaccination, of course, call your doctor, nurse, or clinic. Now, I do know that you have questions. And that's why we're having these discussions all over the city. And so we want to make sure that you have all the information you need to make a decision about the vaccine and to be able to talk to your friends and family about it, to be able to tell them why you think it's important. Now, these are just some of the questions that have come up, but I don't want to put words into your mouth. I want to leave it open for all of you to bring the questions that are burning in your mind. What have you been hearing about? What are the things that concern you? Um, for more information, there's a lot of places that you can go. I tend to go to the Centers for Disease Control. That's the second website. Is sometimes that information can be a little bit technical. And so good places to get non-technical information are at vaccinetogethernewyork.org. That's a really good place. And also the New York City Department of Public Health has really good information. So that's it for me. So I'm going to stop sharing my screen. And I'd love to open it up for any questions or discussions, just so we can make sure that any burning concerns are discussed. Any particular concerns that anyone has? Just want to leave the floor open if anyone has anything they want to ask.
I don't see any questions.
So,
I didn't know if maybe you wanted to mention anything about like flu season, or how we should actually get the flu vax.
Yes, I'll mention two things. So one, so last year there wasn't a lot of influenza going around. So because of that, scientists are actually worried that we might see a pretty bad flu year this year. So I would say this year, more than most, it's probably important for you to get your flu vaccinations, especially if, we recommend flu vaccines for everybody, right? But definitely for people who are older or spending a lot of time with older people, working with older people, because older people are often at the greatest risk for bad outcomes, like hospitalization or death from the flu. Now, you can also, while you get your flu shot, it is possible to get a COVID vaccine. So it is safe to do both together. And I know there's been a lot of talk recently about COVID-19 boosters. So just so everyone knows, boosters are available. If you received the Pfizer vaccine, then boosters are not just possible, but recommended if you're 65 years and older, if you live in a long-term care setting, if you have underlying medical conditions, or you live or work in a high-risk setting. And that's with people who might be at increased risk for COVID because they are either older or have underlying medical conditions. And to be frank, I think that's probably almost everyone that is in the Stanley Isaacs community. So if you did receive the Pfizer vaccine, that's something you can talk to your healthcare provider about, getting a booster and getting a flu shot at the same time. If you got one of the other vaccines, the Johnson & Johnson or the Moderna, there's currently discussions between those pharmaceutical companies and the FDA about getting authorization to do a booster for those vaccines. So I would say something probably to come down the line, but not available yet if you got Moderna or Johnson & Johnson. Great question, Andrea. If you have any others, definitely bring them. Fantastic. So, I mean, if there's no other questions, which is wonderful, then I don't see a reason to keep you here. But I just want to let you know that we're available. Always happy to kind of come to Stanley Isaacs and have these discussions and hear from you if there's any questions or concerns about the vaccine. And with that, we'll give it one last opportunity if anyone has any questions.
Sure. I know sometimes, David, people are, shy, but if there are any questions that come up after, Karina definitely feel free to reach out to me, and I can get those questions to you as well.
Is there an email or phone number that you want to put out to share?
Sure, I'll put my email in the chat.
Yeah, if anyone ever has any questions, you can always reach out to the center and we can get you in contact with them, or if we're able to answer it ourselves, we'll do the best we can. We also have the nurse Lachelle, who's at the center. She's also normally available for questions like that. And I want to thank David and Andrea for coming in today. It was very informative, and it seems like you answered a lot of questions, and I guess it's good to hear that, there weren't any other questions. So thank you for coming in today.
Thank you so much.
So there's one question. If you got the Pfizer vaccine, can you get a booster from Moderna? The short answer is right now, the Centers for Disease Control does not recommend mixing and matching vaccines. Now, I will say, if you go to Walgreens or Duane Reade or any of your local pharmacies, I have heard of people doing this. This is something that is happening in the United Kingdom. It's happening in Canada. They are mixing and matching vaccines. So the short answer is officially the CDC does not recommend this, but this is something that I have heard people doing in practice. What I would say is this isn't well studied, so we don't necessarily know the impact of this. So the short answer is sure, you can go and do this, but it's probably going to help, but what kind of side effects? Does it cause problems? These are questions that we don't yet have answers to. Good question, though.
I think they also asked, they said, since it's a better vaccine, can you kind of just let them know that I think they're kind of similar, Moderna and Pfizer?
Yeah, so Ms. Jagda, I don't know if you want to talk about that. Where did you hear that it's a better vaccine? Oh, I think you're on mute. Oh, there you go. I think you're off mute now if you wanna say something. So it's an interesting point. So Ms. Jagda wrote in the chat that Moderna is a stronger dose. So so the way I would put this is the vaccines are made up of essentially kind of mixtures of mRNA and lipids. Lipids are essentially fat molecules. And basically it's almost like if you take olive oil and you put a little bit of olive oil in water and you shake it up, there's little globules of oil. That's similar to what lipids are. And so that's how, essentially the vaccines are these particles of lipids with mRNA in them. And there are different doses in terms of kind of the number of, it's not even grams. It's not even like, milligrams. It's even smaller than that, but the number of micrograms of mRNA that are in the different vaccines. Now that said, one of the things we're learning is that, the doses between the Pfizer vaccine and the Moderna vaccine, even though one does contain ostensibly kind of more micrograms of mRNA, we're not seeing differences in the clinical outcomes in terms of how much of a robust immune response that somebody gets from either of those vaccines. So even though the doses might be a little different, it is very different in terms of, the doses are different, but there's not much of a difference between the immune response. It's also important to know that the Moderna vaccine is, they are seeking authorization for a booster dose, but they're actually seeking authorization for the booster dose at a half dose at 50 micrograms of mRNA. So the point of this is, I don't think we should be worrying about how many micrograms are in the vaccine. The point is that almost whatever dose you get, the immunity that you get from that vaccine dose is very strong. In fact, there's a suggestion that reduced doses of boosters is actually better because it produces less side effects and gets the same amount of immunity. So I wouldn't necessarily go with the idea that just because something has a stronger dose that it's going to be better for you. I think there's the potential that it could be hurtful if you're taking very high doses of these vaccines when you don't need them. So, I think the science is still evolving on this. So this is just hunches. This is just kind of what Moderna is trying to do right now. So this is not necessarily something that you should take to the bank. And just to respond, so Ms. Jacta is also replying that some studies show that Moderna is holding better. So I want to caution you on these studies because, again, so sometimes what these studies show is that the amount of antibodies, that's the sheer number of antibodies, tends to decline over time. And the amount of antibodies declines over time no matter what vaccine you got and whether or not you got infected with the virus. But here's the thing. So the way our body works is our body learns and adapts, and our antibodies do too. So one of the things that happens is even though the number of antibodies drops over time, when you look at whether or not people are protected, the protection seems to stay approximately flat over time with only very slight decreases. There was a New England Journal of Medicine paper that came out just this past week that described this. And unfortunately, the headline of this article was that it talks about how antibody numbers decline over time. But if you have to read kind of past the headlines to see that while antibody numbers decline over time, immunity does not see much of a decline over time, regardless of the vaccine that you got. So Ms. Jacta, I just want to say, I do understand kind of the perspective that you're coming from, that there's a couple things that might suggest that Moderna might be better than the Pfizer vaccine. Right now, the data that we have is not strong enough to suggest that that is true. Now, more data might come out about that. I do also want to differentiate between the Moderna and Pfizer vaccines, are approximately equivalent from an immunological perspective. The Johnson & Johnson vaccine is not quite as effective. But that said, there's some data coming out saying that people who've gotten a booster dose after the Johnson & Johnson vaccine, that it's just as effective as all of the other vaccines. Now that booster dose for the Johnson & Johnson vaccine, that's still in studies, but that's just something you should know that that's being talked about. And that's where some people might be talking about how it can be just as effective as the others. So there was another question from Michelle Lorenzo, who mentions, for people without insurance, who can they refer to if they develop side effects after vaccination, meaning months after being vaccinated? So I want to be very clear. So there's been a lot of concern about long-term side effects of vaccination. I want to put this in perspective. So if you took a dose of Tylenol, you're hoping that might help your headache. But do you worry about 3 months, 3 years, or 10 years down the line, whether that single dose of Tylenol is causing any side effects? We don't, because we know that if you got any side effects, if you were going to have an allergic reaction or some problem with that Tylenol that you took, it would probably happen when you took that Tylenol. So we have a lot of experience with vaccines, over 100 years of experience with vaccines. And while these vaccines are new, there's nothing in these vaccines that suggests, like the Tylenol, that we would expect long-term side effects way after you've gotten the vaccine. I would think of these vaccines kind of like a pill, right? And so, when you get the vaccine, usually about 24 to 36 hours after the vaccine, sometimes people get things like a sore arm, just feeling a little bit kind of crummy and tired and needing to sleep a little bit more. occasionally, in rare circumstances, sometimes people need to take some Tylenol because they have a fever. And extremely rarely, someone might have an allergic reaction. Now, for the Pfizer and Moderna vaccines, that is the extent of the negative side effects from those vaccines. So, and all of those side effects are limited to within the first couple days after the vaccine. I have not heard of, aside from an allergic reaction, which is we've been seeing case rates of allergic reactions approximately about 1 out of every 150 to 200,000 people vaccinated. So extremely rarely. And I would absolutely agree that if you're one of those unlucky people that has an allergic reaction after being vaccinated and you're uninsured, that could be a problem. And that's something they would be able to take care of at the vaccine site, but they would probably tell you to go to the hospital for observation, and that could be concerning, right? I could understand if you were uninsured, if that was a major concern. However, keeping in mind that that's 1 out of every 150, 200,000 vaccinations. I mean, that is such an extremely low rate. It's similar to, your chances of getting into a car wreck over the course of a year. So uninsured people get in cars and have to commute and have to do things. And so your chances of having a medical expense because of just driving your car is pretty similar to, actually, it's even a greater chance of you having some sort of medical expense from some sort of accident over the course of the year than from having an allergic reaction from the vaccine. And aside from an allergic reaction, I haven't heard of people needing to go to the hospital because of vaccine side effects. Most vaccine side effects, the worst that I've heard is just people feeling a little crummy, having a fever, needing to take a Tylenol, and even that's extremely rare. These are good questions, though. I think they're things that people are talking a lot about, especially the myth of long-term side effects. And I think that's something that the scientific community has not done a very good job of explaining. But our concern about long-term side effects from these vaccines is very low. We're obviously doing the studies to kind of make sure that that's the case. But so far, the studies, we have studies of people who were in the clinical trials, essentially over a year worth of information, and we're not seeing signs of long-term side effects. Again, great questions. If anyone else has any other questions, happy to talk more about these.
Right now, I don't see anything else in the chat. I guess we can give it a minute or two.
Yeah, sure.
If no one has any more questions, I guess we could end it for today. Yeah. Okay. Again, I want to thank you guys again for coming in and answering all these questions. It was very informative, and yeah. So thank you for
Our pleasure.
coming in today.
Thank you so much.
Thank you.
Okay.